Bismillah, alhamdulillah, wa salatu wa salam ala nabiyyina Muhammad. So we're going to speak about something very important to the Muslims and to the people in general concerning premarital testing for genetic disorders that can cause miscarriage. This is taken from a very important book that is being translated with the permission of Allah Azza wa Jal. This book is entitled The Impact of Infectious Disease Upon Marriage. This book was authored by Shaykh Dr. ʻAbdullāh al-Tayyār, who is a member of the General Presidency of Islamic Research and Verdicts in the city of Qasim. He is also a student of Shaykh bin Baz and others. So in this book, the Shaykh examines the medical and Islamic opinions related to infectious and genetic diseases and their effect upon marriage, fertility, and children. Now, this book is pretty detailed as he brings the statements of medical professionals and the statements from the four schools of thought and contemporary scholars as well. He tackles very important topics, and we'll give you some of the topics that he's going to discuss in this book. He speaks about the pros and cons of mandating medical examination before marriage, meaning that when a man proposes marriage to a woman, can her guardian mandate that before you marry, you have to have a medical examination? He also speaks about marrying someone who already has an infectious disease. He speaks about marrying when both spouses already have a disease. He speaks about intimacy when only one spouse has an infectious disease and the other one doesn't, or if both spouses have a different disease, or if they have the same disease. He speaks about pregnancy of a woman who has an infectious disease. Also, conceiving children when only the father has the disease and the mother does not. He speaks about abortion if the mother has an infectious disease that is feared may affect the child. He speaks about making a marriage last if one or both spouses have an infectious disease, or the issue of divorce because one or both spouses have the illness. He speaks about a parent that has an infectious disease raising a healthy child. And he also speaks about the very important issue of testing for genetic disorders that can cause miscarriage. So this book does not only speak about sexually transmitted diseases such as hepatitis, HIV, herpes, and the like, but it also speaks about genetic disorders such as sickle cell, hemophilia, and some types of cancer that are transmitted from the parent to the child. We'll give you just one portion of the topic that he speaks about. It's very important in our day and time, and even with the people that came before us. He speaks about medical examination before marriage, and not just testing for a sexually transmitted illness, but also any genetic illness that may affect their ability to have children. He said, so some doctors have stated that medical examinations are necessary, and it is not hidden from anyone the harm that will come about if one spouse has an infectious disease and they give it to their mate. He says because it involves a type of deception. Because if the healthy spouse knew beforehand that the person they were going to marry had a disease, maybe they would not have agreed to marry them. So just like a person will require a testimony of good character before marriage, they should also require a blood test from each potential spouse. And modern medicine has shown that there can be an accurate analysis that even if the blood type of the mother is not compatible with the blood type of the father, this can result in miscarriages or deformities within the child, and the child may grow up sick. So he says, if both spouses have a blood test, meaning both potential spouses, you want to marry someone, you find someone that has a good religion and you want to marry that person, he's saying that some doctors say you can get a blood test to see if your blood is compatible with her blood. He said, and this will not delay marriage, but it will give you a clear picture about the person you're going to spend your life with. And why is this important? He says, for example, if a woman has a blood type that's called Rh negative, this is a substance in the blood, and the man she's going to marry is Rh positive. The woman is Rh negative and the man is Rh positive. When they conceive a baby, the fetus is going to be Rh positive, inherited from the father. So now the woman is Rh negative and the baby inside her womb is Rh positive. So what's going to happen? The woman's body is going to look at the protein of the baby's body as being a foreign object. So her body may send antibodies across the placenta to attack her baby's red blood cells. And this is known as Rh incompatibility. And so what's going to happen? If her body begins to attack the placenta of her baby, that is when they're going to have a miscarriage. So you may find couples trying to conceive year after year, and they're having miscarriages, and they never realize that the reason why is because they were not compatible with their blood type before they got married. So because of this, some doctors say that genetic testing should be part of premarital examinations that you should do even before you get married. And so they can bring about a clear picture of who you're going to marry. And this does not contradict the decree of Allah Azza wa Jal. Rather, it is part of the decree. And it can be a useful tool, especially if there's a family that has a history of genetic illnesses. So you can find out, is this person going to be compatible with you before you marry that person? So this is just one small topic that is examined in this book. And he gives details, proof from the Quran and the Sunnah, statements of medical professionals and the like. Alhamdulillah wa salatu wa salam ala nabiyina Muhammad.